As we all know, that research has an origin from a French word which is researcher, and it is made of two words, re and search, which means whatever is already existing, we are wanting to research it, again search it, and find out what already exists and what new we can find out. So the research focuses on search for new and unique body of knowledge, and it is a systematic, controlled, empirical and critical investigation of natural phenomena. And here we want to tell you about the word. What is phenomena? Phenomena is nothing, it is an event which occurs, as was earlier said, that it, if you want to find out the infection rate, the infection is a phenomena there. So you want to describe what is the infection rate, what and what is its incidence, and what type of infection, what is the organism which is causing the infection, what is the age group which it affects, so many things. So you want to identify and describe the various phenomena in a research in a controlled manner. Whatever you want to find out should not be affected by other external variables, other external agents, or the phenomenon, that becomes controlled one. So you have to control all the things, whatever you are investigating, that should be controlled. It should not be affected by the results or the impact of other variables which are not under investigation. So we have said that research is a systematic process. So here we just want to tell you about what is the purpose of scientific research and what are the steps of research. We have Dr. Poonam Joshi from College of Nursing, AIIMS, New Delhi. Dr. Poonam, what are the purposes of scientific research? Why we want to conduct this scientific research, and what are the steps involved in conducting a scientific research?
So the purpose of conducting the scientific research is, number one, to describe any phenomena. We want to explore. Suppose you have children in your community who are utilizing any healthcare facility. So we can study the utilization of healthcare services. That becomes describing a phenomena. What type of services our children, under 5 children, are utilizing in the community. Then you can further explore it as you are interested in knowing what are the factors influencing the healthcare services utilization. And if you are comparing two facilities or two communities, and thereby if you are making a comparison, that is under your control. So you are trying to control and study the things. So again, the healthcare services utilization you are studying in the two community, and you are trying to predict the possible reasons for one community to avail the facility of government sector and other community to avail the private sector facility. So you are making drawing comparison, you are at times prescribing, as you are making the population or the sample of your population undergo a particular test. So you are at the end of the study, you may even be in a position to prescribe the strategy. So here we have few steps in the scientific methods. Number one is you are going to select the problem. Suppose in my unit I have patients who have undergone some orthopedic surgery and they had the skeletal pin application. I can see the patients developing infection, why they are developing infection at the skeletal pin insertion site. So that is the problem I have selected. Then I would be defining the objectives. My previous existing practice was to apply neomycin, and now in my unit I have betadine also available. So I can draw a kind of comparison. I can conduct a randomized control trial in which I would be dividing my population. These are the patients who are undergoing orthopedic surgery into two groups. One would be a control group, another is going to be the experimental group.
If we give them a very simple example of selecting a problem, so we said that if they are working in the wards, they have to be vigilant and they have to keep work with the open eyes. And if they just are working in a surgical ward, and they are going to do their wound dressing every day, surgical wound dressing every day. And at the end of the day, like at the end of the 6 or 7 days, they find that none of the wounds are being getting healed. There is an infection in the wound. And then they will just take a sample and see what exactly is the cause of the wound, what organism is causing the wound infection, and they just understand what could be the reason. Maybe whatever the solution they are using there, most of the times they have, earlier they were using the cheetal forceps, and they were putting in a solution which is all infected, and they were using the same one, and that was the reason of getting the wounds infected. And so they will decide what needs to be done. So the problem is very simple, that they have identified a problem, that there is an infection in the wound, infection of the wound in the wards, and what causes that wound infection, and they will try to find it out, and then they can then control what other solutions can be used before going to the randomized
Even
trials.
they can even observe their practices, how good they are in doing the hand hygiene, how
Yes.
good they are in handling the sterile items, how good they are in performing those
Those are
dressings
other
in
factors which
asepsis.
can lead to the wound infection. That
That's
is very important. It's not only the one, it is also their hand hygiene. That is, hand washing is very important nowadays. That is one of the most important carriers of infection. If you don't wash the hands properly, that carries so much of infection. And how you said that practices, how do they apply the sterile technique while doing the wound dressing, that could also be the one reason. But if they see that the same organism is causing the wound infection, that means the source is somewhere else.
So here my first objective would be to identify the prevalence of wound infections among my patients. Then my second objective would be to isolate the microorganism, what is responsible, and then I would be studying the practices of the nurses in that particular unit. So with these objectives, I'll start with the review of literature. In this, I'll do the extensive review of literature, and I'll try to see the material which is available to me in the form of journals or in the form of some committee reports, or during discussions also casually I can hold with the other team members, we can have peer group discussions, and we can try to find out the strategies that we are further planning.
And you know, the selection of problem is one of the experiences, as we discussed, that is one way of selecting the problem. The person or the nurse who works in the ward, and by her experience she selects the problem, that such and such is the problem, and then she studies it, what could be the reason and what can be the factors which cause it, and what remedial action can be taken. But sometimes she has to review the literature also. If she has some interest or idea in her mind, she can simplify, concise that idea by reviewing the literature.
Yes.
It's two-way round. It's one, she has identified a problem, and then she says what has been discussed and studied regarding this problem. And the other way round is that she has an idea in her mind, and then she reviews the literature and tries to find out what needs to be studied. What has not been studied much, that needs to be studied. That can be other way around, that how we can identify a problem.
So review of literature will help you at various point of times. One is when you are selecting a problem, and then when you are deciding the methodology for your problem to be studied, and then finally what type of methods you should use for your data collection and how you are going to analyze the data. So at every point of time, this review of literature is going to help you. And after that, we are going to define the concepts and the variables. Like in my particular study where I am talking about wound healing and the causes, the prevalence of wound infections among the patients, I have to identify the key concepts. Like here, wound infection is a key concept. And then what are the variables under study? What is the age of the person who patients who are getting admitted in my unit, and do they have any comorbid illness? Are they affected with any other illness like hypertension, diabetes, or anemia? That are the variables I can study. Then what type of disease conditions they have got admitted? So these are the variables which I am going to study. And then I am going to state a hypothesis. Suppose I am just doing a prevalence study, I need not have a hypothesis, while in case if I am doing an experimental study, there I would be having a hypothesis.
That means if you give health teaching program
It's
to a
going to
patient,
improve.
to a patient with the wound infection, or the patient with some problem, then your health education will have impact after you have given
Yes.
health education, and then you will compare with other patient to whom you have not given the health education. The results are much better in the patient who had the health education before or pre-operative. Suppose pre-operative patient is going for a surgery, and during pre-operative period you can the nurses can explain the patients what can be the different the procedures which can be followed during the operation, how he has to prevent various upper respiratory infections, exercises, uh, this mobility, ambulation, early
Yes,
ambulation, all those things can be discussed, and that can have impact on the patient who has been getting this education than the other patient who is not given this type of education. So she wants to find out what is the predicted relationship between the
relationship.
two variables.
Then we have to have some assumptions also. Assumptions, they do come in the experimental as well as non-experimental studies, and then we are determining the ethical implications, like
Assumptions,
how
basically they must know that assumptions are the statements which are supposed to be true, but
true
they may
may
not be
not be
verified.
true.
These are nothing. We should not be worried about what the term assumption is. It is nothing. It is, these are the statements which are supposed to be true. Anything which is supposed to be true, you will say that after giving health education patient will do better. So that means you are assuming this, but it may be verified or it may not be verified. That is more important.
I can give another example, like parents of children admitted for surgery, they have anxiety. This is my assumption. So again, I need to test it, and it may come to be true or it may not be true. Then describing the research design. I have to try to select a design which is most appropriate for my study. Like if I'm interested in knowing the compliance of my nursing personnel with the hand hygiene practices, their observational design would be the best. I cannot ask them to do a self report, or I cannot just make them fill up a performa. So the best would be to go for an observational study. So
Suppose
please,
they are doing some nursing procedure. So for that, observation is very important. You observe, actually you observe, and then you see what are the practices they are performing. So that could be an
yeah,
observational
make
study.
use of checklists,
Yes.
use them as tools for assessing their compliance with the hand hygiene. Then describing the study population and the sample, the people, the population which is going to be studied, to whom you are finally going to generalize your findings, that also needs to be defined very well. And then how are you going to plan your data analysis? Whether you are going to use descriptive analysis, or it is descriptive plus inferential statistics you are going to use, or sometimes in qualitative we just review the interviews, we note down, we develop verbatims, and then from there we create the themes, and then we reach to some final conclusion. So planning the data analysis is according to the research design, and then we actually start data collection from our subjects using the appropriate tools, and finally analyzing, interpreting, and then communicating the findings to the people who are interested. And here it's the nursing fraternity who would be interested in knowing the compliance of the nursing personnel with hand hygiene. Similarly, if we are talking about parents anxiety, first of all, as nursing personnel we have to know the reasons for the anxiety, so that we can try out some strategies to reduce the anxiety among the parents. So communication is an essential component which is going to help us to utilize our research findings. So in other words, you can say it is the research utilization, or we move towards evidence based practices. So these are the important steps we have discussed under scientific methods. You start with a problem, you decide the objectives, then you decide the methodology, you select which population you are going to work on, and then plan for the data collection using appropriate tools, do proper analysis of the data that you have collected, and don't forget to disseminate. This is one of the problems that we come across in our nursing. We make research findings, but we do not publish them. So dissemination is an important aspect of making everybody known about the research. Next, we can talk about the scope and the area of nursing research. The scope of nursing research is very wide. You can decide in the area of clinical practice. You can carry out some research activities in the nursing education, nursing administration, or sometimes you can just see how the health system is being utilized. So you can see the outcome of the care, whatever care has been provided to the patients in the community or in a facility, how the outcome of that care is. So in the clinical area, we can examine the nursing interventions and the experiences for health promotion, illness prevention, care of individuals and their families. For example, you have here, again, since I am from the pediatric background, so I would be giving more examples of the pediatric population. You can assess the caregiver stress of the children who are admitted with some kind of congenital malformation, we can say tracheoesophageal fistula. So you are here going to take care of the individual as well as the family members. Then we can carry out some activities which are towards the health promotion, like what is the utilization of immunization services in a particular community which is availing the facility from a tertiary care hospital. Then in nursing education, various methods of teaching can be tested, like whether it is a conventional method, classroom method, using blackboard, or going for distance learning, or going for participatory learning, or you can even try e-learning. So conventional versus e-learning can be tested. Similarly, you can modify your methods of evaluation. Previously, we were just doing evaluation of our students subjectively, but now with the research findings, we have reached to the conclusion that student needs to be evaluated making use of various types of questions. You can have all types, like subjective type you can have essay type, you can have short answer questions, you can have fill in the blanks and MCQs. And sometimes OSCE is also helpful in knowing, in assessing the skills of our students. Then the problems like absenteeism, indiscipline among the students, and the lack of motivation among the students, or even excessive use of mobile phones in the educational institutions, that can also be studied. What are the reasons why students, for what reason they are, how frequently, how many hours in a day they are doing the surfing, for what purpose they are doing, that can also be studied. Then the other areas are nursing administration. You can assess the organizational structure, how motivated your nursing personnel are in the organization. You can try out any new protocol in your unit and see its effectiveness in terms of improving the motivation level. You can see the effect of in-service education programs, and you can even go for the work activity analysis. What are the activities nursing personnel are involved in their day-to-day basis? So this can be an area of research in nursing administration. Then we see the outcome of the utilization of the health system. You can see how cost effective your new model of care is. For example, you can see the functional unit of patient care versus the team method of nursing care. So these two methods you can compare. You can even see the utilization of the informatics in the nursing, like computers have been recently introduced in the ward areas. Our nurses, they are updating ourselves in the area of computer education. They are making their indents, they are making their purchases, they are sending their requisition through computers. So one of the advantages of computer use in the healthcare setup is your information is very much systematic, and your communication is very fast, and you have results readily available to everyone. So these things can even be evaluated, and you can evaluate some existing policies. Like recently we started with the Janani Suraksha Yojana. For the past 4-5 years we have this program going on. We can see how many neonates, how many postnatal mothers have been benefited with this government policy. Then finally, few words about evidence-based practices. As the nursing research is
Why do we
yeah.
want to do the research basically? This is the essence of research. Yes.
Yeah. So this is one of the needs of the hours, you can say. It's a conscientious, explicit, and the judicious use of the current evidence-based practices in making the decision about care of the individual. So what is important here is you have to have the patient's values and patient's preferences also taken into consideration. Along with this, you have the clinical expertise, you have the research evidences, you are reviewing. These days we are overwhelmed with the variety of findings. Sometimes you find there are some studies which are in favor of use of one particular strategy, but at the same time some findings are there which goes against the use. Like in the ICU, if you have a patient admitted on a longer basis with vitamin D deficiencies, we have ample research evidence which suggests that if you are administering vitamin D to these patients, in admitted patients, their outcome, their duration of hospital stay and their period of mechanical ventilation is likely to be reduced. But at the same time, we have other research findings in contrast available which say that there is no such evidence available. So you have to be very careful in selecting the research evidences.
Yes. Basically, what we focused today on is a very important area, that is scientific methods, which is basically an orderly and systematic process, which means that it is logical and it follows steps, various steps, as you have discussed very rightly. And it has also there is also control over external variables which a researcher controls, and the findings are based on empirical evidences. That means the findings are verifiable, they are supposed to be true, what has been found out by the empirical investigation, and then the findings can be generalized, and this scientific method can also use the hypothesis and assumptions, and also can be conducted to test the theories or even also the build the theories. So these are the various important characteristics of a scientific method which we follow during when we conduct the scientific research. And with this, I would thank Dr. Poonam Joshi for giving a very detailed lecture on what research is and what is the scientific process and what are the different methods of research which can be used while we address to certain problems which come in the day-to-day work experience or life, or while dealing with the patients, dealing with the family, neighborhood, and community and society. Thank you very much for your
Thank you.
session.